You asked a great question. We all scratch our head every day. And Dr. Taylor, if you could just stand by, because I want you to verify something we've talked about. Now, with respect to the monoclonal antibodies, again, I'm not a medical expert, but as I understand from our medical doctors, they are efficacious early in the disease. So in other words, as soon as you're infected, within a few days of infection, that's when they're affected. When you come in and you're effectively have full-blown COVID symptoms, that's not as effective for you, and it's not even appropriate for them. Again, the medical doctors can verify that. But one of the things I talked about several weeks ago and continue to reiterate is for people not to delay seeking diagnosis that they are COVID positive, not to delay seeking medical care in an outpatient setting, either an urgent care clinic or at their primary care provider, so that the appropriate course of treatment can be provided before you require hospitalization, which may include monoclonal antibodies. So Dr. Taylor, would you like to comment, is that medically correct that early in the course, once you're positive, before you may even be dramatically symptomatic, is the appropriate time?
Chief McGowen is exactly right. Now, with that said, we would prefer that folks come in early in the course. And if you saw a couple of weeks ago, we have a whole list of folks that we would like to come in, that if they are symptomatic and they're early, we want them to come in and get that treatment. That list included pregnant women, people with immunocompromised conditions. Doesn't mean that if you come in and you're severe, that the hospital isn't going to do and use everything they can to try to save your life. But those monoclonal antibodies work best, like Doug said, when you are early in the course. But what works even better is prevention. And that means that if you are eligible to be vaccinated, you should be vaccinated. Then you don't have to worry about coming in to get monoclonal antibodies, because you will be preventing getting COVID-19 in the first place. Now, there are some watching who say, yeah, but what about those breakthrough cases that you mentioned? Well, I'm here to tell you that the data bears this out. Over 85% of the people who have died from COVID-19, that 2,000 folks that we've lost in our community, over 85% of those folks were unvaccinated. There was less than 10% of the people who died of COVID-19 in our community who had breakthrough cases. So the numbers, as far as death and everything else that we've tried to tell you, they speak for themselves. Prevention is much better than trying to get treated on the back end, especially if you're unvaccinated.